Is COVID-19 all over, or are we going to see a resurgence in cases in the United States because of all the demonstrations and protests and rioting, which of course has brought people into very close confinement and quarters? Hello everyone, this is Dr. Chris Martenson. It is June 2nd, 2020. This is day 131 of our COVID coverage, and we're titling this one, Is COVID-19 Over? We want to look at that, and we've got some more data about is this lab made or not, and I think that's important, and I'll tell you why in just a second. First, we're going to start with our email of the day. This comes to us from Paul. Paul says, Hi, Chris. I was in Africa last year and learned about the honey badger. I was reading Whatever You Do, Don't Run by Peter Allison when I was there, and I loved this description of the honey badger, and here's what that description is. Honey badgers belong to a group of only 4 animals that lions tend to avoid. The other 3 members are elephants, rhinoceroses, and hippos, everybody weighing the tons, right? The last 3 are all enormous with tough skin and armed with weapons like tusks, horns, or massive teeth. The badger, only about 2 feet long and built low to the ground. It's not fast, has no venom. What it does have is tough but baggy skin that helps protect the animal against bee stings. That bagginess also allows it to twist almost 180 degrees if grabbed. If an animal is foolish enough to get a hold of a honey badger, and young lions and leopards sometimes try it, but only once, it faces 2 nasty defensive strategies. The first is an odor that the badger releases from its anal glands. Its stench would make a skunk ashamed of itself. The other is disproportionately long claws. When attacked, the badger aims these claws at the genitals. Anything bleeds to death very quickly if slashed in this area, and the badger has killed animals as large as buffalo that might have done something to upset it. So continuing with the email of the day, he says, saw 2 of them run across a field far from us, but I still crossed my legs. One of the camps we stayed at had some come into the bar, and after we went to bed, they tore the place apart. Broken glass, bottles, cabinets, all just trashed the place. General manager was not amused and told me can't keep him out of anything. They just break into whatever they want. Have enjoyed all of your information. I joined Peak Prosperity to help support what you're doing. Your information got us way in front of the curve on getting prepared. I took action, spread the word. Most people thought I was crazy. Hey, thank you, Paul, for that email. I really enjoyed reading about the honey badger, and I'm very glad to hear that helped you and yours and get out in front and get prepared and all of that. However, after reading this description of the honey badger, I think my new business idea might not be so good. I was thinking of breeding these right here, anxiety companion honey badgers. What do you think? Could be the cure for troubled times. Might not be such a great business idea. Anyway, I got a huge chuckle out of this. This came to us from Judy. Thank you, Judy, for sending this picture along. The anxiety companion honey badger. Yeah, I love the idea. All right, is the honey badger virus, HB19, aka COVID-19, some call it that, is it over? Let's check. The new coronavirus is losing potency, a top Italian doctor says. This came out on May 31st here, and Reuters report here reading, the new coronavirus is losing its potency, has become much less lethal, a senior Italian doctor said on Sunday. In reality, the virus clinically no longer exists in Italy, said Alberto Zangrillo, head of the San Raffaele Hospital in Milan, in the northern region of Lombardy, which, as you remember, is the they say bore the brunt of Italy's coronavirus contagion. Not just the brunt. This was ground zero. This is interesting. The swabs that were performed over the last 10 days showed a viral load in quantitative terms that was absolutely infinitesimal compared to the ones carried out a month or 2 months ago, he told RAI Television. So this is fascinating. The concept here is that the viral loads that they were detecting in the swabs have plummeted, but people are still showing up as infected. So that means that if you have much lower viral load, it's going to be a lot less lethal of a virus. Remember, this is the whole inoculum concept. If you get a larger load, a larger inoculum of the virus, you stand a worse chance of, or a better chance of having a worse disease outcome, right? Because the viral load is really the determinant of how bad the disease is going to be. So they're detecting much lower loads now, and that's fascinating. Italy has the 3rd highest death toll in the world from COVID-19. The article continues with 33,415 people dying since the outbreak came to light on February 21st. And it has the 6th highest global tally of cases at 23,019. However, New infections and fatalities have fallen steadily in May, and the country is unwinding some of the most rigid lockdown restrictions introduced anywhere on the continent. Zangrillo said some experts were too alarmist about the prospect of a second wave of infections, and politicians needed to take into account the new reality. So that's a fascinating idea, and we're going to look at that a little bit more here because there's a way that this ties into the whole, is it natural, is it lab-made? So let's take a peek at this. First, when we look at things, mostly we're seeing a peaked and declining. These are new deaths, so the death counts, here we see them, everybody's peaked and gone down. Brazil is still maybe on the upslope, but they're they're kind of the only one. I mean, it's hard to read in all these squiggles. There's perhaps a few in here you can see not quite down yet, not down here, and things like that. But for the most part, I think you could say the general trend looks something like this. And that's fascinating. So one way is that, of course, cases could be down, and deaths follow cases about 14 days after the fact. So we would want to be looking for peaks in cases about 14 days ago. First up, no, we're not over in new cases. So this is cumulative numbers of cases that we see since 10,000 cases. So everybody down here is pretty flat. The only oddball here is the United States, which is just continuing up on a pretty strong trend here. Not as steeply as it was a while ago, but still racking up a bunch of new patients on a daily basis. So cumulative number of cases is still piling up there. Everybody else flatlined a while ago, but you can see here France, Germany, Italy, Spain. We have to normalize this for population. So let's take a peek at that. When we put the United States, and I'm not doing this is from the Worldometer site. Thankfully, they've done this. When we put the United States on par with Europe with roughly similar populations, here we're looking at cumulative number of cases in Europe versus the United States by the number of days since they first hit 10,000 cases, and they're almost identical lines here. Really indistinguishable. It looks like Europe hit 10,000 cases earlier than the United States. That's why its line, the red line, goes a little bit further. But the United States is really tracking very, very closely. So what's interesting about that is that Europe and the United States had very, very different approaches to how to manage this disease. In fact, every country has its own unique way of managing this disease. Their culture plus their policies combine into some unique approach. And what's fascinating, what's interesting is that it looks like completely independent of sort of the policies that anybody has followed, the virus is following a very similar trajectory. So that is a fascinating finding here. We could also say, nope, it's not over, because here in Iran, they noted a rapid rise in COVID-19 cases. So they relaxed their lockdown, and just very, very quickly after the lockdown was ended, they had a rapid increase in cases. So we don't see this in a lot of countries where you see this first the decline. We haven't seen this V-shape happen in other countries yet, but in Iran, it looks like that's the case. And as well, we would also say maybe, nope, this isn't over, because Dallas County is now reporting in the United States and Texas a record number of new COVID-19 cases and deaths. But let's put it in perspective. This is just 257 new cases and 16 deaths, where the previous high was 253 and 14. So yeah, an uptick, but I don't know if I'd really make a lot out of that particular case there, except to say maybe no, not over yet. And as well, just found out yesterday, Iraq returned to lockdown after what they're calling a surge in coronavirus cases. But again, let's keep it in context. They registered more than 400 COVID-19 cases today, breaking the previously highest number from only a few days ago. So I don't have a graph to go with this one, but it sounds a lot like what Iran was up against. So this was Iraq reimposing a total lockdown over the weekend following a surge of COVID-19 cases, and they decided to institute a nationwide curfew until June 6th. So today is June 2nd, so 4 more days. So at any rate, looks like we could say it's not over yet. What's interesting is some countries have managed to not only get over it, but to really keep the deaths down. Turkey is one such example. BBC reporting here on May 29th, they said how Turkey took control of the COVID-19 emergency. The whole front piece of this article is all about contact tracing and all the elegant things that you can do if you're really trying to get a pandemic under control. But look at this verbiage down here. It comes from about 2/3 of the way down the article. They also say the country, Turkey, has public health lessons to offer, according to the acting head of the WHO in Turkey. Initially, we were worried, he told the BBC. They were having 3,500 positive cases per day. But what has worked is testing, of course, and they did not have to wait 5 or 6 days for results, so they had rapid testing, very important. He also credits the quarantine, isolation, contact tracing measures, but says too soon to judge Turkey's treatment protocols for patients. So this is interesting because this is the WHO head in Turkey. Look what he talks about here. He talks about all this stuff, which is contact tracing, isolation, quarantine testing, stuff like that. But then BBC lets the cat out of the bag here. Controversially, that includes the anti-malarial drug hydroxychloroquine as standard. It's much touted by President Donald Trump, but has been roundly rejected by the latest international research. See this here? Yeah, remember we've been talking about that? This is the Lancet study, which is so bogus, so fraudulent, so obviously wrong that it needed to be retracted many, many days ago. And what's fascinating to watch is the BBC really continuing to tout this. This is against, I can count the BBC as part of the MSM, that's mainstream media. And the mainstream media has been on a path with Dr. Fauci, the CDC, the WHO, all these big leading organizations have been anti-hydroxychloroquine. And you can see, look at this language here, controversially. That includes, has been roundly rejected by the latest international research. Latest, the latest is always good, right? So you can just see the framing of this. It's just dripping out of this article. It's saying, we already all know that. That's settled science, right? But that study that we talked about in Lancet, in case you didn't see that, that was just from the one I put out last Thursday. That would have been the most recent article, but I've been talking Daily Digest, not daily anymore, my most recent update. But at any rate, I've been talking about this for a while, and its study is pure fraudulent. Dr. James Todaro has a much more gentle way of saying that. He says, day 10 since the Lancet study was published and stands without retraction. No response from the Lancet raised glaring data inconsistencies, and Surgisphere, which is the company that allegedly got this data. Every day the study goes unretracted, harms hydroxychloroquine trials worldwide. Is this acceptable? And Richard Horton, is the editor of the Lancet, so it'd be up to Richard Horton to retract bogus studies. And I'm calling Surgisphere, the company that got that data, they're SurgiFraud. Here's Joe Jarvis, just came out recently and was looking into the same paper that we know is fraudulent about hydroxychloroquine. It had a few things to add to that, so I just thought this could add some more color to that. Kind of fun. And let me see if hold on. Yep, I'm going to have to jump down. Okay, I see I've got my slides out of order, but I can work this. I can do this alive. Here we go. So he says, I know there's been extensive comment on the paper, but as someone who has worked with a lot of routine hospital data in African settings, I wanted to make a few specific comments linked to the paper here. He goes into, here's table S3 showing 4,402 hospitalized patients from Africa, 437 deaths. That's the data in this paper here. They say they censored cases on 14th April and deaths on the 21st, at which points there had been a total of 15,291 COVID cases and 1,155 deaths on the entire continent of Africa. All right. So there was this big table here. I'm not reproducing it for you. He concludes from that. He says this would mean that 29% of all individuals who tested COVID-19 positive on the whole African continent were hospitalized in a center with comprehensive electronic medical records and data sharing agreements with Surgisphere, capturing 38% of COVID-19 deaths. Is that likely? How possible is that? If it's not likely or possible, how much can we conclude that that's probably fraudulent? All right. So he says here, the more I read Lancet Gate, that's what they're calling it now, and hydroxychloroquine study, the more implausible any of it seems. Approximately 40% of all African COVID-19 deaths captured in a comprehensive electronic hospital database and cared for in beds with cardiac monitoring? No ethical approvals needed? Really? So he says here, based on my group's research experience in Southern Africa, even in settings with the most developed electronic medical record systems in sub-Saharan Africa, such as South Africa or Botswana, this kind of data cannot be obtained. cannot be obtained. We've recently published one of the few registry-based studies from Africa utilizing the relatively well-developed EMR and death registry in Botswana. Even with 18 authors, it took us well over 6 months to collate, clean, and check these data. That's how it works, people. That's what's involved. The data available to us were basically limited to laboratory data and mortality outcomes, with granular data regarding past medical history, prescriptions, and examination findings not captured in the electronic records. And remember, the Surgisphere data had all of that data in there, including past medical history, prescriptions, all that stuff, right? Our authorship team included the head of the National Health Laboratory and data experts from the Ministry of Health because their input is essential for doing these kinds of studies. We had data sharing agreements with 2 government ministries, and we had to have ethics approvals from 2 national IRBs and institutional review boards and 1 international board. These approvals and agreements took over a year to put in place and were based on strong research collaborations going back decades. Surely the Lancet needs to withdraw this paper pending further review. Either these are not genuine data, fraudulent, or the researchers have taken huge amounts of confidential patient data from African hospitals with no ethical approvals. Neither are good, but the latter is worse. So, well done there, Joe Jarvis. Just coming through one piece of that. That's how fraudulent this is. It's just obviously fraudulent. And I saw lots of cases where somebody had looked at Surgisphere's website, and Surgisphere mentioned they had all these different awards, and it turns out they didn't have any of those awards. They'd actually said, we won this in 2015 from the Hospital Association. In fact, if you check, which I saw one author do, who actually won in 2015 wasn't Surgisphere. So you have a company that's being fraudulent with the awards it's won. It's got no AI people on staff. It claims to have massive data feeds from hundreds of hospitals on every continent, which is these people like Joe Jarvis are saying is impossible. So improbable as to be impossible, right? And yet, despite all of that, you got here the BBC saying, but has been roundly rejected by the latest international research. Oh my God, this is how fraudulent and how corrupt, how absolutely out of integrity the entire system has become. For whatever reason, the idea that hydroxychloroquine could help people and is cheap and effective, that alone is insufficient to motivate the BBC in this particular case, or many large World Health Organizations, to want to promote it for some reason. And whether it's just because, as they say here, because it's been touted by President Donald Trump, and I guess the WHO and the CDC and the BBC and everybody else hates Donald Trump so much that just because he touted it, they have to be against hydroxychloroquine, or if it's something darker than that. And this is just the usual story about money and pharma companies and all of that. But I can tell you this, there is no possible way that Surgisphere got all of this 29% of all individuals who tested COVID positive off of the whole African continent, that they got them into these really detailed tables like that. Just not possible. But you know what? It gets worse than that for Surgisphere. So they also had an article that came out in the New England Journal of Medicine. And just today, the New England Journal of Medicine had to come out and say they've put out an expression of concern about this one, cardiovascular disease, drug therapy, and mortality in COVID-19. This was an article that came out. And by the way, a number of you emailed me this with concern because it talked about ACE inhibitors and ARBs, angiotensin receptor blockers, and came up with all this big data that basically, surprise, supported the idea that mainline pharmaceuticals were helpful. And but at any rate, it turned out all of this data came from the same Surgisphere. And so New England Journal of Medicine, at least, is getting out in front of this a little bit, although I think they're slow to this. They said on May 1st, we published Cardiovascular Disease, Drug Therapy, and Mortality in COVID-19, a study of the effect of pre-existing treatment with angiotensin-converting enzyme, that's ACE inhibitors, and angiotensin receptor blockers, ARBs, on COVID-19. This retrospective study used data drawn from an international database that included electronic health records from 169 hospitals on 3 continents. Yes, this is Surgisphere again. Yes, with their amazing electronic health records from many continents and hundreds of hospitals, right? Recently, they continue here, substantive concerns have been raised. Substantive is the polite way to say that, have been raised about the quality of the information in that database. We have asked the authors to provide evidence that the data are reliable. In the interim, and for the benefit of our readers, we are publishing this expression of concern about the reliability of their conclusions. NEJM, you should have gone a step further. I know it's being polite and giving the authors a chance to provide evidence the data are reliable, but I think given what we see here, you can clearly say this is fraudulent data, and you ought to be retracting that paper right now. And by the way, everybody associated with this is just such a stain on their careers. Just awful. All right, is COVID-19 over, though? We haven't really answered that. Maybe. We don't know yet. I think in 2 weeks we're going to know, because here we are. This is just from, I pulled this off of Twitter this morning here on June 2nd. Huge peaceful protest happening right now in Portland, Maine in response to our fascist police state. Well, it's peaceful unless it's a really perfect environment for spreading COVID. I don't know what happened to this idea of being in a pandemic, but all these people are lying down. They have their hands behind their back. They are protesting. They're really close to each other. They're saying, I can't breathe. I assume many of them have face masks on, but not everybody, or the masks might not be fitted snugly because, we're all getting a little sloppy with that at this point, I think. So we'll find out in a couple of weeks what's going to happen, because this is just one example of a lie-down protest like this. There were many as well. There are a lot of protests going on. People are shouting and screaming, like singing. Those vocal expressions seem to be really good at communicating COVID-19. Plus, from the jackets, you can tell it's a cool day and it's a little cloudy. So I think this is perfect conditions for COVID to spread. We'll find out. I need to just talk really quickly, too, that the case for this virus being lab-made, well, now it's not all scientists agree, Chris, that this had to have been natural. There's a lot of scientists saying, hey, we're not so sure about that anymore. So this is a June 2nd article here. The case is building that COVID-19 had a lab origin. Okay, and this came out of Independent Science News.org down here. There's a researcher, a scientist down in Australia, Petrovsky, so I can tell you who that is, who said this. In his statement, Petrovsky goes on to describe the kind of experiment that, in principle, if done in a lab, would obtain the same result as the hypothesized, natural, zoonotic transfer, rapid adaptation of a bat coronavirus to a human host. So we talked about this a while ago. He's going to explain the same mechanism here. So it's good to have some backup on this. Take a bat coronavirus that's not infectious to humans and force its selection by culturing it with cells that express human ACE2 receptor. That would be the Vero E6 cells, probably. Such cells having been created many years ago to culture SARS coronaviruses, and you can force the bat virus to adapt to infect human cells via mutations in its spike protein, which would have the effect of increasing the strength of its binding to human ACE2 and inevitably reducing the strength of its binding to bat ACE2. Okay? That's the mechanism. You can force evolution to operate very, very quickly in a cell culture medium. Viruses in prolonged culture will also develop other random mutations that do not affect its function. The result of these experiments is a virus that is highly virulent in humans, but is sufficiently different that it no longer resembles the original bat virus. Because the mutations are acquired randomly by selection, there's no signature of human gene jockey, but this is clearly a virus still created by human intervention. In other words, Petrovsky believes that current experimental methods could have led to an altered virus that escaped. And in fact, he said that we can make that stronger. In fact, we know that using this method, humans exactly have used this method to create viruses that are more capable of infecting humans. And if they escaped from the lab, would have been very, very bad. That happened with an H1N1 virus, and it's happened as well with some of the coronaviruses. But it may go further than that. All right. And so this goes even further than that. This is from June 1st. Scientists in different articles say COVID-19 may have been cooked up in a lab. Leading immunologists and geneticists have told the Daily Telegraph there are two unusual aspects of COVID-19 that raise the possibility it was man-made rather than a naturally occurring virus. The first is that the virus binds to human ACE2 receptor cells more strongly than it does to any other animal, including bats. So if this did jump from another animal, it jumped from a bat or a pangolin or a civet or any other animal, and it jumped into humans, when you test this coronavirus against those other cell lines or in those other animals, it ought to have a higher affinity for those, because it was created and naturally evolved to be a very tight binding virus in, say, a pangolin. But when it jumps to a human, it's kind of a poor fit. What's interesting is that it's been discovered that this virus binds more tightly to human cells than any other animal, including bats. So that's a strong condition to say that this evolved in humans, but nobody out there is proposing the idea that we have coronaviruses like this one, like the honey badger virus, naturally evolving in humans. Everybody knows it had to have come originally out of a bat, maybe with a pangolin receptor binding domain. The second feature is that it has a furin cleavage site. Yay! We're getting this in the press now. That's fantastic. How did that polybasic furin cleavage site get in there? That's a good question. That its closest genetic bat coronavirus relative, rat TG13, does not have. This site makes it significantly more infectious. Israeli geneticist Dr. Ronen Shemesh, who is working on treatment for COVID-19, said in his opinion, the virus was more likely created in a laboratory than evolved naturally in nature. There are many reasons to believe that the COVID-19 generated SARS-CoV-2 was generated in a lab, most probably by methods of genetic engineering, he said. I believe that this is the only way an insertion like the furin protease cleavage site could have been introduced directly at the right place and become effective. Dr. Shemesh points to the insertion of a furin site as the most unusual aspect of COVID-19. I agree. I believe that the most important issue about the differences between all coronavirus types is the insertion of a furin protease cleavage site at the spike protein of SARS-CoV-2. Such an insertion is very rare in evolution. The addition of such 4 amino acids, PRRA, alone in the course of only 20 years, very unlikely. Absolutely the case. Now, this story takes a curiouser and curiouser turn, but as a reminder, remember we featured this guy, Peter Daszak. He was running the Eco Health Alliance thing, and the NIH yanked his funding. We're going to talk about that in just a second. But first, a reminder, 60 Minutes said, put it this way. This was their take on it. This was the framing. Trump administration cuts funding for coronavirus researcher jeopardizing possible COVID-19 cure. First, that's just flat out wrong. Peter Daszak was nowhere near a COVID-19 cure. He wasn't working on a cure. He had no clue about a cure. He was just doing gain-of-function research on coronaviruses and going out and wild sampling coronaviruses from bats just to see what was out there. And he was also involved in with the bat woman out of the Wuhan Institute of Virology, WIV, that they were actually doing gain-of-function research on that stuff. So here's where it gets curiouser and curiouser. That's just a quick reminder. Here in Zero Hedge today, NIH won't release Wuhan biolab docs due to pending investigations. The good article. I love the way they wrote this up. In 2014, the U.S. National Institutes of Health provided grants to Eco Health Alliance, a global nonprofit organization which funds research on infectious diseases, including studies of bat coronaviruses in partnership with the Wuhan Institute of Virology, WIV, which has become the focus of international investigations into the origin of the coronavirus pandemic. On April 15th, when there were just 2 million cases and 128,000 COVID-19 deaths, according to official counts, currently at these numbers, an organization called White Coat Waste, which is an organization that's against animal testing and spending public monies in animal testing, that White Coat Waste filed a FOIA request with the NIH for all correspondence with the State Department regarding the WIV, according to National Review. 4 days later, on April 19th, NIH Deputy Director for Extramural Research, Michael Lauer, wrote in a letter to EcoHealth, there are now allegations that the current crisis was precipitated by the release from the Wuhan Institute of Virology of the coronavirus responsible for COVID-19. Given these concerns, we are pursuing suspension of WIV from participation in federal programs. And by extension, Peter, your grant's getting cut too. Well, that's got a slightly different spin on it than Trump administration cuts funding for coronavirus researcher jeopardizing possible COVID-19 cure. That seems like a slightly different angle than this one. All right. This article continues and says, 5 days later, Lauer told the organization, the National Institute of Allergy and Infectious Diseases, an institute with the National Institute of Health, under the Department of Health and Human Services, has elected to terminate the project. NIH does not believe the current project outcomes align with program goals and agency priorities. That's bureaucratic speak for we gotta dump this. This is a hot potato. We're out. So peace out on that program. They dropped it. So 9 days after the FOIA request from the White Coat Waste to the NIH, requesting communications with the State Department about the WIV. The NIH cuts funding to EcoHealth, which was experimenting with coronaviruses. That's what this is all about. They cut the funding. Then check this out. The FOIA request hits a brick wall on May 22. However, when NIH FOIA officer Gorka Garcia Malin wrote back, blah, 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 we have to withhold these records because they're permitted to do that when they're being compiled for law enforcement purposes, when disclosure could reasonably be expected to interfere with enforcement proceedings. So they're withholding the documents on this because of law enforcement proceedings. That sounds pretty serious to me. That doesn't sound like they're trying to interfere with a COVID cure. That sounds like more like a crime was committed potentially. Lauer, in his original correspondence to EcoHealth, wrote, "It is in the public interest that NIH ensure that a subrecipient has taken all appropriate precautions to prevent the release of pathogens that it is studying." Ouch. That's getting curious and curiouser. All right. So I think that the case for it being lab-made is getting stronger and stronger here. I think that all the virologists who are very, very prominently saying you're nuts, Chris, and really arguing and debating this whole thing, they've gone strangely silent. But we'll see if we can get one of them on the program to actually talk about this, because this is serious. And here's why I think this matters. If it turns out that this was created in a lab, it makes sense that it was not potentially a completely stable lab creation, right? So when you create a virus in the lab, it might work, it might not, but even if it does have gain of function, sometimes those gains of function are lost very quickly because it's not a stable virus particle. It takes a lot of evolution to create a stable one. And so maybe what we're seeing with all those declining COVID curves is consistent with the idea that this thing escaped from a lab somehow. It shouldn't, we shouldn't have been doing that kind of research, but it did, caused all this damage, but maybe it'll just go away. It's because it's no longer stable. All right, I got to talk about the protests really quickly here. This is my favorite quote. "Learn how to see, realize that everything connects to everything else." I don't see these protests, the forest. If you're down there and you're looking at trees, you've got Antifa, you've got police violence, you've got the way that the black people have been treated by police, you've got racial issues, you've got all these things. But in fact, to me, if you want to see everything, the headwaters of the troubles are right here. So this is the forest. Looting is the trees. What do I mean? What is the forest? It's deep unfairness, structural unfairness in the system that's been squeezing people. The Federal Reserve has been the proud owner of that. This is a chart that goes back for a very long way, looking at the share of U.S. household wealth by income level, the top 0.1%. Look at this. They start here at about 7% in the late 70s, and just now they're up at like 22%. The top 0.1% is about to have as much wealth as the bottom 90%. This is deeply unfair, and this is the headwaters of the troubles. You can't, all the other things we just talked about, yeah, there are a lot of grievances, and a lot of those things need to be addressed, but if you want to have a stable society, you have to have a stable or a reasonable wealth distribution. This is completely unreasonable, and it stems from this idea of financialization. And that's what the Federal Reserve is defending. And financialization, simply defined, is making money by using money. You don't make widgets, you don't cure anybody, you don't paint any houses, you don't grow any food. Financialization are people who work on Wall Street and private equity and in hedge funds and all of that. Very sophisticated jobs, very smart people working there. But for all of the billions of dollars that they earn and trillions of dollars that they earn, air quotes, they don't produce anything. And they just use money to make money. And so they're gaining a larger and larger and larger proportion here of the nation's wealth, larger and larger. And the bottom 90% are losing in this story. And that's unfair. And we're humans and we're primates, so things are unfair. Well, that's what the Federal Reserve is doing heroic jobs every single day to rescue the markets. Here's an example. The daily rescues of the stock market. Here we see the stock market started to sell off here like this. And then all of a sudden, it's like a ruler got busted out. Look at this. No extra volume down here in the market. It's actually declining a little bit. And it just follows this ruler straight advance, And this is what a market rescue looks like. Is this something that we see very rarely? You see it all the time. Here's another day. The market starts to roll over and sell off, volume drops, and the market just goes up on a straight ruler line like that. Last night, So yeah, this is for June 2nd. These are futures. These are things that are trading in the overnight. This is 4 a.m. Eastern, right? The markets aren't open. This is the futures market for the S&P 500. We had all these stories of looting and death and destruction. Fifth Avenue is destroyed. Providence is destroyed. All these cities destroyed. And what happens? Well, stocks became worth a lot more overnight because somebody stepped in and bought 30 points, right? From 30.45 to 30.75. This is, and really, U.S. stocks ought to be going up strongly in the night of the worst riots in decades? No, of course not. But this is what happens when you have the Federal Reserve protecting the rights of the wealthy to own a larger and larger percentage of the nation's wealth. You get stuff that looks like this. And this is deeply unfair. And of course, this is adding to the troubles, not reducing them. I understand why the Fed thinks they're doing what they're doing, but it's really not helpful. All right, the conclusions for today. Yes, COVID is still with us. It remains to be seen if it's actually less lethal. It might be. It might have lost that PRA, polybasic furin site. Maybe that just got popped out of there because, it was an unstable addition to that thing through gain-of-function research at the WIV. We don't know. If it is less lethal, then I want to see some full genomic DNA sequencing to find out if it somehow lost function. Maybe due to some of these unstable motifs being selected again. So maybe it lost the PRRA, or maybe it lost something in the binding zone, or maybe it lost some other random amino acids. We don't know. But if that's the case, then the lab-made story, it gains another vote. It looks like more and more likely. The Lancet is refusing to retract a paper based on obviously fraudulent data. That just goes to show how far down this whole corruption slope we have slipped, where a major institution, another one, says, yeah, we don't really want to, we can't even admit when we've got grossly wrong things going on over here in our organization. We're just going to stick to the story that we like, not what's true. The number one source of wealth inequality is the Federal Reserve. This is why, for reasons like this, but mostly this, I've been predicting for a long time that we are going to see social instability, and that includes this idea that comes out of Plutarch, where he said thousands of years ago that the oldest and most fatal ailment of all republics is a gap between the rich and the poor. That's the deal. We've been creating this gap between the rich and the poor for many decades. These protests didn't come out because one single black man was murdered by the police. That may have been the spark, but this is the tinder that was being laid out, a very dry forest down here. So I want you to be able to understand this is the forest here, okay? This whole thing, this is the forest. The looting we're seeing now, that's the trees down there, but this is the source of it. We have to figure out how to have a more equal and just distribution of wealth, or we're going to see more social unrest is my prediction. If you want to understand what the Fed's up to a little bit more, you could watch this, which is our W2F What the Fed 2. And so before I go, as a reminder, you might want to just think about getting a t-shirt and joining our movement. Go.
Hi, this is Evie. I wanted to ask you to purchase one of these t-shirts because I would love to be walking down the street and to see somebody with the word resilience on them, and I would know that you belonged in our tribe, which would be wonderful, and I would be excited to meet you. So come by and purchase one of these shirts if you'd like. They're durable, they wash well, they come in many colors, and Chris and I wear them all the time, and it's just a wonderful way for us to identify each other and to help the world understand what we're working on.
And as well, remember to plant a garden. I still think you're going to want to have a garden. This is the one that Evie and I are putting in here at our personal place. And remember, I'll tell you something that the CDC and the WHO, everybody should be telling you, but they aren't, which is that you have to prepare your own terrain. Make sure you have plenty of vitamin D. Make sure you have plenty of zinc, plenty of selenium, and take quercetin as a way of getting the zinc into your cells. These right up here are going to help you not get sick if you do get sick as well. Remember, the first sign of sickness, take some of that organic elderberry syrup. This is my favorite here from Gobble Mountain. You can check them out here. And as well, N-acetylcysteine and vitamin C. These are all things that if you do get sick can really help maintain a better course of disease progression. All right. Thank you very much for listening. I got to run. We'll be back on Thursday. Thank you very much, and be safe, everyone. Please be safe out there. Bye-bye.
Hi folks, this is Adam Taggart, Chris's co-founder at Peak Prosperity. To get your own Resilience shirt, simply go to peakprosperity.com/shirts. Each shirt is made of 100% organic cotton and produced in the USA. And when your shirt arrives, please send us a photo of you wearing it if you feel comfortable doing so. We'll add you to our wall of proud Peak Prosperity members who are showing the world that resilience is the way to a better future. Thanks for watching.